Hi and welcome to all the Neetpg aspirants who are going to give the upcoming Neetpg 22 exam. So in today's one clinical sign a day, we are going to discuss about signs in multiple sclerosis. So the first sign we are going to discuss is Hermite sign. Hermite sign is also known as barber chair phenomenon. So Hermite sign is basically the electrical sensation down the spine or the limbs, which is usually provoked by flexion of the neck. So these two signs which I am going to discuss, Hermite sign and the Euthox phenomenon, are transient and paroxysmal symptoms of MS. So why they are transient? So transient and paroxysmal, for that we have to see the pathophysiology of MS. So as you can see, this is the normal saltatory conduction which takes place in the normal individual, but when there is demyelination as here, okay, and when the conduction impulse travels through it, there is no saltatory conduction, partially demyelination and remyelination which occurs during the course. So during that there is exposure of the channels, the sodium channels and the potassium channels of the nerves, and due to that there is a sudden decrease in the action potential, threshold of the action potential. So Hermite sign is basically a result of spontaneous regeneration or generation of action potential due to the reduced threshold of the action potential. Okay, so this is Hermite sign. The next sign which we are discussing is your Euthox phenomenon. So basically, again now, so Euthox phenomenon describes the recurrence or worsening of a focal MS deficit, which is usually a visual blurring due to decreased conduction through the demyelinated fibers at higher body temperature. So for example, when there is a hot humid climate, or there is exposure to direct sunlight, or use of hair dryer, or intense exercise which increases your body temperature, or when you are having a hot bath which is classically described, okay, or you are having an infection, so infection which is giving rise to fever. So during these conditions there is decreased conduction through the demyelinated fibers, and due to that there is exacerbation or recurrence of the symptoms of MS, and this is usually a result of prolonged refractory period of the action potential. Okay, so these were the two signs which we have discussed in multiple sclerosis. Apart from that, for today we have a question for you. Name the drug which increases the walking speed or gait in patients with MS and its mechanism of action. Okay, give your answer in the comments and we will also reply with the explanation of the answer in few days. Okay, thank you.